We have the honor and the pleasure of having the person, Nora Super, who has been asked to lead the White House Conference on Aging and make that a reality. And we certainly have been waiting for a number of years for that to come together. And the fact that that is coming together, and we actually have the person who is leading that charge with us today, I think is a great deal, and it's an honor to have you with us, Nora. We're really excited that you're here today. Nora has a very distinguished career. She has been in a leadership post for Health and Human Services in the U.S. government. She's also served as leadership around healthcare and long-term care at AARP National Office, and was also served as a leader within the Kaiser organization as well. So we're really pleased, and I know that I'm sure she can say this herself, but I know, sort of watching from a distance, it's been a whirlwind for you, and I know you've been sort of traveling, quite a bit, because you do want to get out and hear what people have to say about what the issues are impacting aging in communities, the disability communities as well, and so kind of gauging and assessing what those issues are and how we might be able to address them, and culminating in the White House Conference on Aging. And so we're really pleased to have you here with us. I was hoping that we'd have sunny California, LA weather for you, but I'm so sorry, it's closer to DC weather, it feels like now. Who knew? Here we are in May, and we're still experiencing that. But it's a real pleasure that you can be with us today and to share with us some of the thinking from Washington, D.C., and to hear your perspective based on things that you've been hearing out there and what we have to look forward to. So please help me in welcoming Nora Super to share her comments with us.
Good morning, everyone. It's so wonderful to be here, and I appreciate always coming to California from the East Coast because we get to sleep a little later when we're here. So that's a good change. And I don't think people in California are complaining about rain these days, right? So I will take a pass from a few sunny days to let you all have some rain. It's such a pleasure to be here today with the Los Angeles Aging Advocacy Coalition. Your work to bring together aging services organizations in Los Angeles to be the voice for seniors, their families, and caregivers has never been more important. You may be familiar with a 2013 landmark study from the University of California that predicted by the middle of this century, Los Angeles County will have more older adults per worker than anywhere else in California or the country as a whole. Los Angeles County is only one of the most prominent examples of what's happening from coast to coast. And the United States, as you probably are aware, is experiencing an amazing transformation. People are living longer than ever before, and this is a good thing. It's due to medical advances we hadn't seen before. Now, as people reach the eligibility age for Social Security and Medicare, they're thinking they may live 20, 30 more years beyond that. That's not something that we had in past years, and it's really transformative. Los Angeles particularly stands out because the shift comes from an earlier explosion of immigration and growth. So as I look out on the audience, and one of the great things about coming to a place like Los Angeles is the tremendous diversity of people that are part of the community here. And so while there are many people of color in the room, I think one of the predominant colors in LA in the coming years, though, will be gray. And as we look at that as a reality, I think we all need to move forward in thinking about how to address these challenges. Given these unprecedented growths, the work that you all are doing to bring together the voices of older adults, share with each other, move forward together in our work, will ensure that all of us have longer and better lives. In other words, our work must echo the goal of the original 1961 White House Conference on Aging, which was to discuss and propose solutions and answers to the unique problems facing older Americans in this country. As part of our work to find those answers today, I'd first like to share with you a little bit about the White House Conference on Aging, the overarching themes and ideas that have emerged from our regional forums, policy papers, web comments, listening sessions, and finally to tell you how you can get involved in the White House Conference on Aging if you aren't already. I see many familiar faces and know many of you all have reached out to us or been a part of discussions we've had, and we really appreciate all of that. The 2015 National White House Conference is intended as a national conversation of the issues most important to older Americans. When I go out and talk about the 2015 White House Conference on Aging, I like to think of it as the 3 C's: conversation, celebration, and change. Conversation is what we're doing today, what I've been doing since I started this job, and it has been a whirlwind, but I love going out and talking to people and listening. There's so much power and energy in our communities about how to improve their own communities and how we can help all of us as we age. There's a lot to celebrate too. One of the reasons why we decided to go forward with this, as you all know, the Older Americans Act has not been reauthorized, and that's something we need all of your help to make happen this year. But as a result, our conference doesn't have appropriations that have been there before and the statutory requirements that have been there before. But it gives us a new opportunity to rethink how we discuss these issues, how we move forward, and celebrate. And President Obama really felt strongly that he wanted to have this conference this year because of what we can celebrate. It's the 50th anniversary of Medicare, the 50th anniversary of Medicaid, the 50th anniversary of the Older Americans Act, the 25th anniversary of the American with Disabilities Act, the 80th anniversary of Social Security, and the 5th anniversary of the Affordable Care Act. So there's many, many things for us to celebrate. We also want to celebrate all that older Americans contribute to our society, continue to contribute to our society, and honor and respect and celebrate their achievements as well. And finally, we know we must change because the face of America is changing greatly, and many of the systems that we put in place, the programs that were put in place in 1965, need to be updated to reflect new realities, need to look at ways that we can structure things. We've changed a lot as a community, and so our programs need to evolve to reflect those changes. One of the first questions everybody asked me is, when will the conference be held? So I would have liked to have been able to announce it today, but you will hear very soon. It will be in July in Washington, D.C. It's not just a virtual conference, as some people have been saying, but we are using new technology to make sure that we are able to reach as many Americans as possible. You think about the ways we communicate today, they're just so different from even 10 or 5 years ago. Almost everyone in this room, I bet, has a smartphone in their purse or in their pocket, and we look at it to figure out how to get from A to Z, how to communicate, especially with my millennial children, and how to get information about everything from the weather to the sports statistics that are going on, and meaningful conversation with people that we love. This wasn't true 10 years ago. Even I talked to some of my colleagues who worked on the past White House conferences on aging, and they'll talk about faxing documents and writing things, and I think, wow, now we can touch a button and reach literally millions of people. The people that follow the conversations that happen in the White House is amazing, and the input that we get there. So we really want to be able to take advantage of that. Just yesterday, I participated in a wonderful town hall put on by several diverse elders aging organizations and was able to hear the testimony of many people and their feelings and passion about how to change things. We were able to use technology in that space so that people for whom English wasn't their primary language, they could have an interpreter in, a system in their ear that could help them participate fully. That's tremendous progress for people that English isn't their first language, and for all of us who need better ways to communicate, for people who have limitations or disabilities, new ways to make sure that all of us can be part of the conversation. It's very exciting. And then hearing the people's stories from yesterday is such an important part of what we bring to this conversation. I was able to hear from an older gay man, African American, talking about his experience in growing old with HIV and how we need to recognize some of the challenges, particular for LGBT communities, that they face as they age. There was a 89-year-old Hispanic woman who was so lovely. She kept insisting that I take a gift from her, but she loves President Obama, and she gave me many things to bring back to the president to share. And I had to explain to her that President Obama has put in very strict ethics rules, and so we're not allowed to accept these gifts. And I think when I told her the president wouldn't let me do it, that was what convinced her it was okay to give back this very nice ring she was going to give me. So I I'm just overwhelmed by the warmth and generosity that people have. We heard from a Filipino woman who herself had been a victim of human trafficking, had been in a home for years. But that's not what she wanted to talk about when she came up. She wanted to talk about how important vegetables and fruits were to your diet as you age, and with such strength and conviction and passion about how we all need to take better care of our bodies and what we put into it. And so just amazing testimony also from caregivers that I hear all over the country, of people that are doing these really difficult jobs and not earning enough money to do this really important need, and something that we really hear a lot and are working hard to make some changes there. We're also, one of the exciting things too is that we're working across the federal government. People often say, we need to break down these silos, and boy do we, and especially with all of the different funding streams that come in, getting to talk to people, each other. And I feel very strongly after having this experience. I've worked in Washington, D.C. for 20 years and have worked primarily in healthcare issues, interacting with the housing folks, the transportation folks, the justice folks, everybody that brings so much to the table about how to solve these issues in a productive, meaningful way has been so important. We've been working directly with Secretary Castro, who's passionate about housing and ways that we can make our communities more age-friendly and livable, working with mayors across the country to help adopt initiatives such as the Milken Institute's Successful Aging communities, and identifying ways that we can all be better prepared. I know Supervisor Solis was here, who was a wonderful and dynamic Department of Labor Secretary. And if you all haven't had the opportunity to hear from Secretary Tom Perez, I would also encourage you to do that. Such passion that he brings to these issues, and is so committed to this, and anything that we ask him to do, he's there, ready and willing to take on any requests we have. So it's just been great to work across, and I know around communities such as LA, you all experience that same rich collaboration that we have. You probably know we've been hosting regional forums. We've been co-sponsoring them with AARP, who's been a great partner with us. The Leadership Council on Aging Organizations, many of your organizations are part of those groups that have helped us plan these and put them forward. We held one in Tampa and Phoenix, Seattle, and most recently Cleveland. Our next one will be in Boston at the end of this month. And like this event, all of these events are live streamed, which is also another way we're using technology to reach out to others and allow them to be part of it. At each of the regional forums, we have breakout sessions, so the people in the room actually go and talk and work and come up with priorities and challenges and solutions. And this is the favorite part of every session that we have, and the energy and enthusiasm people have to bring to these issues is just incredible. When we first scheduled them, we put 90 minutes down, and I thought, that's too long. People aren't going to be able to talk about this stuff for 90 minutes, but we'll try. And all the feedback we always get is, we need more time, we're coming to solutions. And so we're able to gather all this input and bring it back to us and allow people that are web streaming it can do it in their own communities, in their homes, other ways that we're taking all that input as all. So let me just tell you a little bit about the 4 issue areas that we've been focusing on, and then what we've heard some from the feedback. As we've gone around the country, there have been 4 common themes that have emerged. Our first focus is preparing for financial security in retirement. This is something that is on the minds of many Americans as they get older, as they worry about outliving their assets. So we have the tremendous privilege of living longer, but then the concern about, do we have enough saved in order to support ourselves during this? And these challenges have changed. Private pension options have changed. There are fewer defined benefit plans. Fewer of us work for the same employer for 30 years, so the structure of how we move forward has really changed too. Social Security is incredibly important, and we hear this everywhere we go about what we need to do to strengthen and improve Social Security. It's the main source of income for many Americans, and especially women and minority populations. Nearly half of unmarried older women rely on Social Security for 90% or more of their income. 46% of older African American beneficiaries, 44% of Asian beneficiaries, 53% of older Hispanic beneficiaries get at least 90% of their total income from the program. So we really need to look at these programs and see how it can sustain people so that they actually can live on Social Security as we move forward. And we're looking at those challenges. It's something that the President feels strongly about, and how we can put forward. But we'll need your help to get support from members of Congress about the importance of having this income for people as they retire and allow them to retire with respect and dignity. We also know that health and long-term care costs can take a big chunk out of retirement savings. So whatever you may have done to save as hard as you can, if someone in your family has a stroke or gets Alzheimer's disease or some other debilitating illness, it can wipe out all of your savings. And, you know, and the stunning thing is people over 65 on average have about $70,000 in assets, and that's less than what it costs for 1 year in a nursing home stay. So we really are looking for new opportunities to increase savings, to make it easier for savings. There are a lot of proposals the President put forward in his budget, and we're moving forward on expanding those options, working with employers, working with small employers, working with states. I know California has been looking at a state-based plan option, looking at what we can do with the rules to make sure that these are more immediate and available to people. But we want to make sure that people are not only financially secure, but they're also active and independent as they age. And so our second focus area is healthy aging. And so while we know we can't stop the passage of time, we've learned a lot about what we can do to stay healthier as we age. If there's one thing I've learned from many of the wonderful health professionals we have working with us on these issues, it's that physical activity is incredibly important. If there's one silver bullet, it's physical activity, and to ward off practically anything. So we just, you know, one place they joke that sitting is the new smoking. And so I think, that's true. We all need to remind ourselves, get up and walk around and, take the stairs when we can, or you just walk places instead of always driving. I know this is a challenge in LA, and that people don't walk as much around here. And so I just encourage you, although I do think LA is a shining example of many things to help in age-friendly communities, giving more opportunities for people to walk is really important. But also preventive health screenings and immunizations. In the Affordable Care Act, there are all types of new preventive services. And unfortunately, the uptake hasn't been as good as we thought it would be with older Americans, and in certain populations in particular. So we're looking at ways to really enhance education and awareness, both with healthcare providers, but also with individuals and communities themselves, about the importance of preventive screenings and what they can do to help save lives by catching things earlier on. And then primary prevention for older adults, of course, includes reducing risk for preventable injuries such as falls. I know this audience knows that this is a significant cause of disability in older adults. 1 in 3 falls each year. And we just had a conference back in Washington with the National Council on Aging and the Administration on Community Living, looking at falls prevention. Again, just tremendous amount of work and what we know and about how we can prevent these falls, and making sure we get that information out to people. We're updating a national plan on falls prevention and want to be disseminating all of that out soon. I mentioned that yesterday I also had the opportunity to go to the Long-Term Care Education Center, where many women primarily are being trained as home care workers. It's based on one of our Center for Medicare and Medicaid's innovation projects that's looking at ways to improve care for in-home supportive services and maintain the health of these consumers, but also to prepare the workforce that serve these consumers. I had the opportunity to talk to a group of women whose primary language was Spanish, and we had an interpreter that helped us have Q&A from each other, and I was just struck by how much these people that go into these professions really want to do the best for all of the people that they care for. They want more training. They kept saying, could you just give us more? Could you tell us more about how we can do this best for, and many of them, as you know, are caring for their own family members, many of them who have disabilities or interests trying to care for their own loved ones while they're going out and working for others. This is hard work. And it's for those of us who've been family caregivers, which I think that another theme I hear as we go around all the time is we're all experiencing this in our own lives today. That's why I think the conversation is really ripe for us to be discussing this, because as people are living longer, we're starting to say, wow, I live in LA and mom and dad lives in New York, and I really can't take care of them from here. What can I do? What are the resources that are available there? How do we deal with this in the best way possible? This is happening all over the country, and people are really struggling with this, and we need to make sure that we're providing supportive services for family caregivers, and as well as home care workers and other paid personal aides. I also, another thing I hear all the time is about transportation, and transportation is something that is really critical as people age. And when we did our regional forum in Seattle, I had the opportunity to visit a wonderful senior center, Asian American Referral Center that you all may be familiar with. Beautiful place. And they serve wonderful Asian food. They have like Thai night one night and Chinese night another night, and the food is so good. I mean, you can see why everybody wants to go there all the time. But I talked to some of the, and they have Tai Chi, they have exercise, they have motion, all this community that's there. But some of the folks, their biggest challenge was getting there. They had to take 3 buses to get there, and then the bus schedules would change, and then there would be something. And you know, we hear these stories over and over about how we have these great places for people to gather and get resources, and which keeps them healthier and ultimately cost our system less as we're giving them, you know, good nutrition, you know, meaning and purpose in their lives and meeting with each other, exercise, food, but then just getting there is a huge challenge. So that's something that we all need to think about, better ways that we can take some of our resources and put them towards making sure people can get access to these services that are there. I'm sure you all know that there are a lot of people today who need long-term services and supports, but that number is just going to grow dramatically. Today we estimate about 12 million people, and we think that is going to double to over 27 million people in the United States by 2050. So we are looking very hard at long-term services and supports and what we can do to help unpaid caregivers as well as paid caregivers. We need to ensure that we have the right long-term services and supports to help older adults remain in their communities. And I said before, we need to ensure that those providing these services are paid a fair wage and have benefits that help sustain them in our communities. And finally, our 4th focus area is to prevent abuse, neglect, and financial exploitation of older adults. And we know that elder abuse undermines health and hope. And this is sort of a hidden secret in many communities. They don't want to talk about it. It's difficult. Many times the abuse can be the responsibility of family members, and so it's difficult to broach these issues. The Washington Post just had an article, and there have been a lot of articles lately exposing some of these abuses, but this was, you know, particularly touching, and I think what the reality of many of the things that we deal with. It was a Montgomery County man who was caring for his elderly mother, and she was bedridden, and finally when someone was called to help her, she, you know, had severe bed sores. She had compression socks that had been on her feet for months at a time, and the son just didn't know. Nobody could train him about what to do, that, you know, you need to turn your mom, you need to take these socks off and put other ones on. And so we need to make sure that we're providing resources to people that are providing this care so that they understand some of the challenges and ways that you can prevent this and make sure that we aren't having that. I mean, and I think too, another thing we hear a lot about are financial exploitation scams. I mean, everyone I talk to knows someone who was called or sent an email or something threatening or encourage them to, you know, put their money somewhere. This is something where we're working with the banking community, we're working with financial industry to try to make sure we can prevent this exploitation and make sure that we have the right protections in place so that our elders are safe. So today, for the first time, I just want to give you some of the feedback that we've received. And what's remarkable, I think, is the consensus that has emerged in each of these areas. No matter where we go in the country, people really feel strongly about several things. So under retirement security, 3 major themes have emerged. As I said earlier, first, ensure Social Security solvency for the long term that matches demographic changes. Second, increase personal savings options such as My RA and ensure that necessary financial literacy and education will enable and encourage savings. And third, protect and increase employer-based retirement plans, including auto-enrolled 401k plans. With healthy aging, input and comments have coalesced around 2 ideas. As you all were discussing earlier, we need age-friendly communities and a holistic response to aging that is inclusive and culturally responsive. There's so much happening around this country in this way, and we just need to gather all of this momentum and make sure that this happens because it's really exciting. We hear that all the time that we need a culture change in the way that we view aging, which recognizes all that older Americans contribute to our society, which taps into their incredible experience and wisdom and what they can bring to helping us solve these challenges. You know, everywhere I go, that's a resounding theme, and I think we know that it's time to shift the conversation that looks as the coming age wave as some tsunami that's going to overtake us, but rather one that recognizes that we can lift all boats by tapping the power of experience to improve our communities and society. We also know we need greater support of formal and informal caregivers, and we need a sustainable long-term care financing model. Comprehensive reform should provide continuity of care from acute to home care settings for all income levels and help alleviate financial burdens on older adults and families. And third, we need to advance person-centered care that maximizes independence and choice. Finally, based on public feedback, we have a couple of recommendations on elder justice. We need to increase research on the prevalence rates, impact of abuse, and evidence-based interventions. And we need to increase training for direct service providers, law enforcement officials, and financial assistance institutions. We're really excited to have a new Attorney General, Loretta Lynch. It took a while to get her in office, but she's very dynamic. She's very interested in elder justice issues and brings a lot of passion. And a lot of what we hear is we need to train law enforcement about how to detect, prevent elder abuse, but also prosecutors who are prosecuting these cases to understand the rights of our elders. And so she's very passionate about this, and we're really excited to have her energy and enthusiasm working on these issues. So let me close by saying, as we look over these two themes, I was reminded of an anecdote involving two Californians, Alice Toklas, who was born here, and Gertrude Stein, who was raised here. And when Stein was 72 and about to undergo critical surgery, she asked her life partner, Toklas, in a quiet voice, "What is the answer?" When Toklas did not reply, Stein said in a louder voice, "In that case, what is the question?" And so for us at the White House on Conference on Aging, the question we're trying to answer is how do we as a society best address the public recommendations, themes, and ideas that have been raised? Finding these answers is our major challenge, and we need your voice and your ideas to bring to this. We can't do it alone. We need all of your voices to be part of our discussion, our dialogue, and our conversation. You are the experts. It is here in Los Angeles that you're grappling with many of these issues and coming up with very creative and innovative solutions. We welcome your thoughts. We want your input. We look forward to continuing this dialogue together. Thank you very much for the opportunity to be here.